A comprehensive geriatric assessment should include assessment. So should include assessment of functional capacity, again, their ability to complete their activities of daily living by themselves or with assistance or with supervision. Also their independent activities of daily living. An assessment of their fall risk, their cognition or their mood disorders or lack thereof, polypharmacy, which I'll cover also in a little bit, their social support, their caregivers, their finances, their care goals. So care plans, care goals, what's, again, coming back to what's important to the patient, what's important to the community resident, what's important to the family. So their care goals. Advanced care preferences and directives. So at every visit, we should have a discussion with our patients, with our caregivers about advanced directives. A lot of families wait until it's too late when the patient or the community resident does not have the capacity to consent, to give written or verbal legal consent to determine who their healthcare proxy will be, to set up a living will, to set up financial powers of attorney, to determine who will take care of them when they can and who will speak for them when they cannot speak for themselves, especially in a healthcare setting. So that's a discussion that we have with our patients and caregivers earlier on, and advise them, as uncomfortable as it may be, to have that discussion with their family, with their caregivers, and establish that as soon as possible. A comprehensive geriatric assessment may include assessment of vision. This is may include vision, hearing, which we actually recommend as part of our service because sensory deficits, vision and hearing, affects cognition sometimes, affects memory, affects mood, and affects the person's ability to function independently. Speech, dentition, how are the dentures fitting? They have them, but they won't wear them. They take them out to eat. Nutrition, are they eating properly? Coming back again to food insecurities, are they able to afford a complete, well-balanced meal at least once a day or more, hopefully? Their weight, are they gaining weight? Are they losing weight? Is this voluntary? Is this involuntary? Are they trying to lose or gain weight, or are they just losing weight because of other medical conditions, or they're not able to eat properly? Their gastrointestinal, their GI tract, stomach from mouth all the way down, and urinary, definitely sexual function, their living situation, and their spirituality. So a comprehensive geriatric assessment may include assessment of, but a couple of these I think should be included in a geriatric assessment. A comprehensive geriatric assessment starts head to toe, past medical history, history of present illness, their health, the ANP-C, history and physical, cognitive capacity, neurological screening or assessment, ears, nose, mouth, throat, respiratory assessment, so hearing, as I said, vision, sensory screenings, their functional ability, medication reconciliation every visit, every time, and we are asking the patient to tell us what they have. We may have it on our electronic medical record from the last time we did a reconciliation, but every visit we ask the patient to tell us. If they can't pronounce the names of the medication, we have them spell it, what's the dosages, the milligrams, micrograms, units, and what's written on the label as far as the interval. From doing medication reconciliation, a lot of patients or community residents or caregivers realize that they're actually not taking the medication at the right dosage or the right interval that they thought they were supposed to be. So medication reconciliation, every visit, we're asking the patient to get all of their medications together and come and tell us what they're on. We're not telling them what we have on our system. Nutrition, gastrointestinal, genitourinary, musculoskeletal, balance, most important, gait, fall risk assessment, and prevention, teaching for prevention, bone integrity or risk for osteoporosis, or strength assessment, or sarcopenia, incontinence assessment, are from urine and fecal, so bowel and bladder. Psychosocial, environmental, and social assessment. And again, most importantly, their functional status. Neurology and endocrine assessment. Hematology and immunology assessment. Infection prevention. Preventive health and wellness. Spirituality and coping. And family leisure pleasure activities. Also, as important and sometimes overlooked, is sleep hygiene. How are they sleeping? If they're getting up every hour to go to the bathroom, they're not getting quality restful sleep. Mental health, most important, one of the 4 M's. Are they having panic attacks, anxiety, depression, suicidal thoughts or intent? Their mentation. Life stressors, what's happening in their psychosocial environment, what's happening in their homes, their relationships, their sexual health, employment and finances, their family dynamics. Are they the caregiver for everyone? Have they taken in their children's children? Are they the primary caregiver for their grandchildren, which is increasingly happening? Blended families, domestic abuse, emotional and verbal, physical abuse, neglect, or abuse and violence. The Comprehensive Geriatric Assessment also includes an assessment of eating disorders, hopefully to identify if they're eating disorders. So again, coming back to food insecurity, are they losing weight because they plan to lose weight, or they're losing weight because they have a mental issue that makes them think they're overweight, so they're not eating, or they just can't afford food to eat a nutritious meal. Laxative abuse or use, and bulimia. Excuse me. Cigarette, alcohol, and illegal or illicit substance use or abuse. Support system, family, which include family, friends, teachers, clergy, whoever is there for you. I have patients who their healthcare proxy and their support is their neighbor, and I think that is very amazing of the neighbor. Coping ability and mechanism, counseling and referral as indicated, most important. I have a brief video that I'm going to play about a comprehensive geriatric assessment.
When they are able to function, people can age in a good way. As they get older, people often become ill with chronic long-term illnesses. Their ability to function begins to deteriorate, and gradually, problems with their functional ability emerge. As their state of health and functional ability deteriorate, elderly people are in increasing need of health services. Multi-illnesses can result in the need for extensive treatment and rehabilitation. Elderly people themselves want to be able to live in their own homes for as long as possible, able to function and healthy. The system of services should develop effective ways of working to assess the health and functional ability of elderly patients, as well as their rehabilitation and ability to live independently. Comprehensive Geriatric Assessment is a multidisciplinary endeavour. The assessment focuses broadly on factors that weaken functional ability. Based on this, the patient's true need for treatment can be defined, and the care and rehabilitation plan can be made. Assessment of different areas of the patient's state of health and functional ability generates quality care that is patient-centred. Assessment reduces the number of treatment days in the long term, and in this way, treatment costs can be brought under control. The Comprehensive Geriatric Assessment comprises medical assessment. The medical assessment is done by a doctor. Assessment of functional ability. Functional ability is assessed by a physiotherapist. Nutrition assessment. A nurse takes care of the nutrition assessment and health measurements. Assessment of care and rehabilitation. The planning and assessment of care and rehabilitation are done in multi-professional teams, comprising a doctor, nurse, and physiotherapist. The teams may also include an occupational therapist, psychologist, and social worker. The patient's state of health and functional ability are assessed extensively, also taking into account the environment in which the patient lives. The patient's own resources are mapped, and these are supported. The patient's motivation with regard to self-care and living independently are of particular importance. Training provides healthcare professionals, doctors, nurses and physiotherapists, and social workers with an understanding of the significance of comprehensive geriatric assessment, its content, and the planning involved. After training, participants are able to assess the feasibility of comprehensive geriatric assessment in their own organisation. For more information, please go to www.savonia.fi.